share things that have come up at your tables. Again, really thinking about innovative ideas that have been sparked for you to take back with you, next steps, action items in the area of policy, practice, or research. And so we'd love to hear sort of highlights for tables that want to share of things that have come up that you think everyone should hear about. But also, if you have questions for our panelists, we're happy to take those as well. So we're not going to have time probably to go to every table, so we'll start with volunteers of tables who are interested in sharing some of their conversations or one or two items that have come up. I just ask that if you're interested in starting, please raise your hand, because we do want to make sure you have the mic so everyone can hear you. So any volunteers for things to share? Okay, there and then there.
Well, of course, I'm Emily Jackson in Asheville, North Carolina. Our table had a very, very rich discussion, and one of the ideas that came to us, we were talking about farm to school and farm to child care, was especially in rural areas, the ability for people to be able to afford this product without making the farmer take the burden on. And so our idea was that maybe preschools or child care centers could partner with K-12 systems and or hospitals or other institutions to help combine their buying power to, so that everybody can get the same fresh, locally grown product. So that was one of the many wonderful ideas from this table.
Great. And we had some volunteers over here at the table in the front.
Hi, our table was very excited to share what our thoughtful discussion was on. We really felt like a great opportunity was that CACFP piece, especially around reach and dissemination and getting more programs to uptake the program. But we had a really thoughtful discussion on what it is, for what barriers exist. And a lot of the barriers were data sharing across programs about eligible families between the school meals and the CACFP program. We also talked about the barriers of paperwork for programs to actually enroll, and then the barriers for the monitoring. So how can we facilitate coordination between the CACFP monitors, the licensing monitors, and the child care development block grant monitors as well, so that you have a lot less burden on the actual programs. And then there's also that kind of cross learning, and you having those you're having shared actions that are there. So is there anything else I should add? Okay. Okay, yeah, about the community reach for the CACFP, that it's not just about the individual children, but then there's some communities that are actually eligible to receive CACFP for that free and reduced price lunch, so making sure that we have more uptake of that.
Other volunteers to share? Or questions for the panelists also are fine.
I'm Sue Renner, and I'm the director of the Mirage Foundations in Denver, Colorado. And we have been incubating a project called Early Learning Ventures for the past 8 years. And it's a shared services network. We have over 600 childcare providers in Colorado participating. So that was a big focus of our conversation here at the table, was how do we engage small, independent, market-based childcare providers, and particularly with CACFP. One of the things that we've done is used a cloud-based childcare management system to lift off the administrative burden of that program. And a recent time study we did showed that one of our centers is saving 20 hours per week on the paperwork for the food program. So if anyone's wondering what that actually costs in time for a provider, 186 low-income children, and he was dedicating a half-time staff position for that paperwork. So we've totally automated that, and we're happy to share that technology with anyone that's interested. So let us know. But I think the point of really focusing on the administrative burden of administration of these programs is critical. And what we say is it's like Maslow's hierarchy. You know, we want to bring providers wonderful quality enhancing projects and programs, but if they simply don't have the time and the money to focus on the basic needs of their program, they're not going to be able to take on these new enhancements.
Well, we were very happy to have a small table so we could have a great conversation over here, and a lot of our conversation revolved around licensing regulations and trying to strike a balance of having good, strong licensing regulations, but if they are too high, then there's a disincentive to become licensed, and therefore more of those kids are going in unlicensed care. And then if you do put best practices in QRIS, but that's not funded, then there's no incentive to meet those higher standards. So really looking that this ultimately comes back to funding and incentives to actually provide high quality care.
And just a reminder as we're waiting for our next table or question, if you have notes from your conversations, please add them to the idea wall in the back. Even if you've reported out, that's a great way to ensure that your ideas are being captured.
Okay. Just kind of picking off on the idea over there that was mentioned about the cloud-based CACFP management system, we spent a little bit of time talking about also the use of the central kitchen model for providers who are not in a good position to make their own nutritious meals that may meet the new CACFP patterns on site, and how the central kitchen model has been successful. There's a number of successful models, even some I just learned about, that are serving rural-based providers, which is a new one for me because I think they've mostly been center-based that I've heard of. But it's a great model for connecting with farmers. It streamlines the process, and you get also the bulk power behind that as well.
Just curious, did anybody have any conversations that were, you know, if we just knew the answer to this question, that would be a game changer? Or I ask selfishly because that would make my job a lot easier. Or if we just could figure out how to get this policy changed, we know it works, that would be a game changer. Any of those sort of conversations or ideas?
So hi, I'm Stephanie Rubin from Texans Care for Children. I represent the rear guard table over here. We were hard at work, actually. I wanted to point out a couple of challenges we talked about and good ideas. A couple of the challenges are around the collaboration, and I mean, we know in early childhood that we have a fragmented system, and when you add health into it with different payer sources and different agencies, I think it sort of calls upon all of us, if we want to make early childhood centers anchor institutions to some degree of good health care, there's a lot of work we all need to do to make sure that we're communicating. Pediatricians don't feel like, you know, their role is being subsumed by child care folks, and that, you know, the turf is improved and removed. We talked about at our table a couple of things that we're working. One is encouraging child care providers to promote breastfeeding, not just because of the benefits of breast milk itself, but because, as we know from research, and there was a recent Fresh Air on this, that when moms eat a varied diet, that translates to kids in breast milk, and that's also an advantage to get kids their taste buds ready for vegetables and interested in vegetables. The other thing we talked about was the use of the federal food program for local gardens and purchasing local food. And there are folks here at our table from Brooklyn and other places who are using it that way, but there was a question, and I think we could all use some more information about whether that's, is that a valid use? How do child care centers do that? And some guidance on that question. Is she asking the question?
Are you asking Geri to respond to that question?
Go for it.
So the allowable costs for CACFP are pretty broadly defined, but they can be used for administrative funds and then to pay for food. So if what you're doing is using the money for what is going to be food, then you're paying for the food. So is that what you're asking? Yes, there are restrictions, and there are a lot of issues around that, and it's one of the things, in fact, that I know that the CDC has been working on as part of their project, and I think they've made some good progress. Diane is working with you on that, right, Meredith? Yeah, and so part of the problem has to do actually with the state or local health departments, and so some of them say, you can't eat, homemade food, baby food, or you can't eat stuff that's out of the garden, all of which is completely ridiculous. But they have the power, right? So if I say dumb stuff, you don't have to do it, but if they do, you do have to do it. So, right. If you say dumb stuff, I don't know, do people have to do it, Karen? So, okay. Okay, Karen does not say dumb stuff. She wants to make that clear. I do occasionally, but in this case, I'm right on target, I believe. It is actually a problem. It is a very significant problem. And I don't know, Meredith, if you would like, because I know the great work that you guys are doing, I would turn the question over to you.
Well, and I know Natasha also wants to weigh in on the ridiculousness of licensing laws.
Because there's food safety.
Yeah, there's food safety issues, but I will say, Diane Harris the Diane she's referring to is really the CDC specialist on this topic, but I have been impressed in my limited role in it in terms of participating at the Georgia State Farm to Preschool Summit. And it was as a speaker from USDA spoke last time, there's often misperceptions. And so at that summit, we heard several providers saying, but that's against the rules. And having a summit where you have the rule knowers, the official word there being like, oh, wait, no, that's not quite accurate. And it was amazing how quickly some clarification was able to be made. But then there were some dumb rules, like you couldn't grow tomatoes in your garden because, it's in the nightshade family. And we worked with our food safety people, and actually very quickly were able to get that changed for the state of Georgia. So I think there can be low-hanging fruit on getting some of those issues resolved.
Yeah, and I would just say, this goes back to yesterday when they were like, the rule says we can't do it. I cannot tell you how many times I hear that. And it's like, which rule? Okay, tell me which rule, and let's look at that rule. Because when you kind of back it up, a lot of time it's an interpretation. There are local food safety that are being implemented by local public health, but they're on the kind of food safety side of things that are being implemented and interpreted in ways that are actually negatively impacting our efforts to improve access to fresh fruits and vegetables in these settings. But once you figure out what is the barrier, like which rule, and if it is actually a rule or just a practice and interpretation, then you can start to gain that understanding and start to solve the problem. So that's what, when you hear it's a problem, it's a rule, I want everyone to say, okay, which one? Give me the citation, and then kind of back up your conversation on how to do that.
And often, from previous experience in school meals, if you reach out to your state departments, they're really willing to put out that updated guidance because they don't want those myths out there either. So we found them, at least in school meals work in the past, to be a really great partner in terms of helping to fix some of those issues.
I'm Carol Scott from Child Care Aware of Missouri, and this table was a really diverse group, and one of the sort of fundamental research data sets that would be valuable, I think, to a lot of us is something that just shows somewhat definitively differentials in quality across exempt from licensing programs and licensed programs. Politically in my state, I have to say, there are some really excellent unlicensed programs. And at the same time, I have a strong belief that there is probably, generally speaking, a statistical significantly statistical difference in quality between the two. So from maybe race to the top states that had QRIS systems that had to include exempt programs, that might be a source of those data. But somewhere we need to have a way to say it makes a difference in the quality of kids' experience around a lot of things, but particularly around nutrition, physical activity.
Great, thank you. I think we're out of time, unfortunately.